Good afternoon, everyone, and thank you for joining us. I hope everyone had a nice weekend and are able to go out and enjoy this beautiful weather today. I'm really happy to be having another webinar today in our Restart Kentucky series. We had two last week, one with public health officials and another with Dr. Paul Coombs, talking about the state of Kentucky's economy and how quickly we can rebound from this pause that we're all taking. We had a great participation last week. If you were unable to join us on those webinars, all of our webinars are available on our website, kychamber.com. After the fact, we do have a limit of how many people we can host on these calls. So if you're unable to sign up for one, just know that those will be available just a couple hours, usually after we wrap up. We try to put them on the website. We want to thank our partner in Restart Kentucky and the webinar series, the KCTCS Community and Technical College System, for being a great partner for us as we restart Kentucky. You all may know that Restart Kentucky is an initiative of the Kentucky Chamber on really planning on how we can safely and methodically reopen Kentucky's economy. In addition to a webinar series, we also do have a task force that we are working with to get recommendations on how we can reopen in an industry-specific way to the governor. Hopefully this week, we will also make those public. We've also released a survey today that we took of businesses over the last couple of weeks, just kind of detailing their thoughts and feelings on reopening the economy. So make sure to check that out on our bottom line website, and all of that will be on our regular website as well, kychamber.com. And today, I think the timing of this could not have been more perfect. We've planned this for a little over a week now. But today, if you guys have been listening to Governor Beshear and his 5 o'clock press conferences, you know that today is the day that some medical services can start to reopen. As you all know, and I know they'll go into detail a little bit more in a few minutes, almost all procedures besides those kind of life-saving procedures have been halted. We've called them elective procedures, but a lot are also preventative parts of medicine as well. And so I think we know that the hospital systems across the state have been hit pretty hard with this pandemic, not only being on the front line and being the caretakers of the people who are sick and going into the hospital, but also from an employment part as well. If you look at Kentucky, and I know we have people from all over, east to west, north to south on this call, in many communities, your hospital is one of your major employers, if not your largest employer. And so you all know that during these times when we have not been able to have these elective procedures, that tough cuts have had to be made and some changes have had to be made. And so we're really happy that today is hopefully the start of a slow and methodical and safe reopening of all of our hospitals and medical facilities across the state. So the timing of this was great. And at this point, I will kind of introduce the panel and then turn it over. We have Gerard Colman with Baptist Hospital, and Gerard's a board member of the Kentucky Chamber. We have Garren Colvin with St. Elizabeth's Hospital up in Northern Kentucky, and Garren is a board member. And we have Donovan Blackburn with Pikeville Medical Center, and Donovan is our healthcare policy chair here at the Chamber. And moderating our discussion today is John Copley with Aetna Better Health here in Kentucky. John is a board member of the Kentucky Chamber, and he is also chair of our opioid task force. So with that, welcome, gentlemen. Thank you all for joining us today. I should say the disclaimer that every time that we hop on a Zoom call, we kind of cross our fingers in hopes that it works. Knock on wood, we've had pretty good success. I think all of us are getting a little better each and every day at hosting these kind of calls and are getting a little more used to it. So right now, knock on wood, it seems things are going well. But at this point, I will turn it over to John. And again, all of this will be recorded and available on our website after the fact. So thank you all for joining us. And John, I will turn it over to you.
All right, thank you, Ashley. This is a tremendous trio of hospital leaders, so looking forward to this. Before we get started, I did want to publicly acknowledge Ashley, our Kentucky Chamber President and CEO. True leadership is demonstrated during a crisis. She's done a remarkable job on behalf of the business community and the state as a whole. Watch Kentucky Tonight on KET tonight at 8 p.m. to see Ashley's leadership in action. Okay, let's join in. Thank you to all who are joining us from across the Commonwealth. We have a pre-selected set of questions to be followed by one submitted during the registration process. Feel free to submit more questions via the chat function, and I'll do my best to get to them. To keep it simple, we'll begin each question with Mr. Colvin, then Mr. Blackburn, and finish with Mr. Colman. Gentlemen, please start by giving us a brief summary of what measures your hospital has taken as a result of the COVID-19 pandemic. How bad has the outbreak been in your area? And do you expect it to get worse? And are you prepared for the number of cases to increase if they do?
Thank you, John. And thank you, Ashley, for doing this. This is great. So St. Elizabeth, the first thing we did, I think if you go back a few years, you remember the Ebola issue. We put an infectious disease response team in place for Ebola. So as soon as the coronavirus came out, we basically brought back our IDRT team. That was our first step to prepare and get us ready for what was coming. Secondly, and once the disease became community spread, we went to daily temperature taking. So everybody entering our hospital each and every day and each and every shift their temperature is taken and make sure that they don't have a fever. Secondly, we have taken the position to mask 100% of the people in our institution. I know this was above the CDC's previous guidelines, but we felt it was necessary. Since we've taken those precautions, we have not had an active spread of the disease within the walls of our facilities. We are fortunate, we have 4 hospitals, but we could dedicate one in our area. So our Fort Thomas location was our isolated area where we have about 200 isolation rooms so that we can attack anyone who is what's called a PUI, people under investigation, or a positive patient. And then to get to your other questions, Northern Kentucky has had a relatively, what I'd say, consistent number of people testing positive, but more importantly, almost a low number of people actually needing hospitalizations. So we had a high of 50 at one point in time, but really declined to the low 30s until we had one of our nursing homes, one of our local nursing homes, had a little bit of an issue. So we took probably 35 of their patients, their residents. We brought them into our house. We basically have sterilized that facility, prepared them, and we will be giving some of those patients who really don't need acute health care back to the nursing home. And then, you know, I would say that the forecast for us looks bright. As long as we can continue to basically deal with what I want to say is routine flow, and then if 1 or 2 nursing homes has a flare up, we'll be able to deal with it. But when you look at our capacity, we're probably about 35% utilized right now. So we have significant capacity and a lot of ability to handle what else is coming.
Thank you. Mr. Blackburn.
Okay, well, and likewise, Sean, I think what you're going to find is a lot of the same answers across the board, more than likely, but I'll hit on a few of those points that you made or request. You know, again, I'm in Pike County, far eastern Kentucky, so as the regional hospital, largest regional hospital in our area, we service about 450,000 people. And I think, you know, our geographic isolation, how we're spread out, has really kind of benefited us on top of the social distancing. So, so far to date, we've tested 249. Now the 249, we've only had 6 positive, and out of the 6 out of the ones that we've tested, we just finished up with the Kroger testing, and we ended up with 3 positive tests with the Kroger testing. But overall, we've had 9 positive tests, of which only 2 actually ended up in the hospital. Unfortunately, we had one that was a deceased. But out of that, all the things that we've done really to prepare was a lot of the same things that you've heard. You know, we created early on our COVID team, and there's about 15 on that team that we meet every morning at 9 a.m. And then on top of that, we also created a physician team. So they're talking on a weekly basis about all the different different directions coming down, both from Frankfurt and through the CDC. And likewise, because of the Ebola unit back in 2015, we became a designee center, and so we had put a plan into place with, as a rural community hospital, we actually have 2 infectious disease docs on top of that, a director of infectious control. So we had a lot of the protocols already in place, and it obviously at a much greater rate stressed us a little bit. But we did things such as putting policies in place for our PPE to make sure that we didn't have unnecessary resource burns. We looked at our visitation policy, a lot of the same thing, restricted visitors from coming in, really stressed the necessity for social distancing. We screened our staff, and we still do that every single day. We focused on a lot of our IT needs, putting things into place such as early on the opportunity for somebody to come into our clinic. We have an 11-story clinic, so very robust business. So as they came in, having the opportunity to call in and then send them a page when it was time to see their provider. We developed our surge plan so that we could handle a possible surge as they came, which included creating a cohort unit and again, to isolate those patients from the rest of the population of the hospital with negative pressure, which again allows the air to vent outside of the hospital, not throughout the hospital. We did that with several other areas of the hospital also, such as areas in the OR and the ED and OB, and again, just putting necessary things into place to make sure we were giving the best care to not only our patients, but also being able to protect those that were coming into the hospital. The hospital has about 72 ICU rooms. Those were already negative pressure. So we were able to move some things around again to create that cohort unit. But again, like a lot of other hospitals, I'm sure the things you've seen in the press, we set up our triage tent for the ED, and as people were coming through, screening them differently and bringing them through differently. But we also went above in the name of social distancing by, we had just signed a contract with the school systems to provide telehealth. And that came at a great time because we were able to actually roll that out in a much quicker fashion. So not just with our primary care, but with all of our specialty service lines as well. So focusing on drive-through lab, actually we have a drive-through EKG. We have our pharmacy, which actually has, it's like set up like a banking system where you actually have a tube system. So it allowed patients again to get access to healthcare without actually having to come into the hospital. So again, a lot of the things that we did was to act to what the CDC and the governor was asking us to do. But a lot of the policies and things we put in place has certainly put us in a state of readiness with the policies that we already had. So if there is a surge, then yes, certainly we're definitely prepared and able to take care of it.
Thank you, Donovan. Chair.
Yes, thanks, John. So, we did a lot of the similar things that you've already heard about. Baptist Health has got 8 hospitals across the Commonwealth, and in Southern Indiana. So part of your question was, how were those volumes of COVID patients and how hard did you get hit? Several of our sites saw a lot of COVID patients, but when you're all the way from Paducah through Louisville to Lexington down to Corbin, as you can understand, there's a lot of variation in the number of patients that came through. But we did activate our emergency response teams early on in the crisis, and not only at the system level, but we actually implemented them at the hospital level as well, and they included ID physicians, as you've already heard. So I think there was a lot of good early action and reaction to the COVID crisis, including the social distancing that Donovan had talked about and putting things in place. And also our medical group, it's quite large and has a significant video digital platform. And because of the crisis, we were really able to exercise that, if you will, and to several thousand visits now have come through to try to continue the social distancing that we had in place. But every hospital that we had a little bit of a different volume that came through. We had as many as at any one time, just below 100 patients throughout the system. Now we're seeing a decrease in that, thank goodness. We're very pleased about. So right now as a system, we have about 71 total inpatients, but we've had several hundred over the course of the crisis that have come through Baptist Health, again, system-wide from one end of the Commonwealth to the other. But all the other things that you've heard already here today have been put in place. And we're really pleased with the way it's going. And I think because of a lot of the early action by the governor's office and by our fellow Kentuckians, we've really been able to help reduce that, flatten that curve, if you will, and push that out to give us the capacity that Garren's talking about. I think he brought up a good point. We're all underutilized right now, which is a good thing when you have a crisis. Our surge plans work. Our surge plans held. We do have the capacity that Garren has referred to in all of our hospitals throughout the Commonwealth. So I think we're ready to really activate when we need to surge plans and treat this disease the way it is, and then also ramp up some of our operations that Ashley talked about. We're starting to bring healthcare back online in the Commonwealth, which is, I think, is a good thing for those people who have put off. I don't like to use the word elective. I would say necessary medical procedures. I just call them, they're delayed, because people are in need of healthcare and they've just pushed off and delayed access to care, which they really truly need.
Thank you, Jared. So back to Garren with the next question. Obviously, we're in the midst of unprecedented uncertainty. So to kind of make some general observations, as a hospital CEO, what do you know at this point about the COVID-19 and its general overall impact to our state?
Well, I would say two things. The first thing, as a hospital CEO, this state is blessed to have so many caring professionals and healthcare employees that are dedicated to serving the Commonwealth of Kentucky. I think we're in a better place because of those individuals. But the disease itself, it's a community spread disease. And the biggest problem that we found early on is so many people carrying the disease are asymptomatic. So about 80% of the people who have COVID-19 really show no signs and don't even know they have it. And that was a problem when you're congregating as a community, because you're spreading disease and not knowing it. So once we were able to socially distance, then I think we were able to stop the spread and help focus on the people who are needing attention. And the other thing that is definitely clear, this disease is a disease that attacks the respiratory system. So anyone who has any affliction, asthma or COPD or heart failure, any comorbidity that's heart lung related, are going to be susceptible to the COVID-19 disease.
Thank you. Donovan?
Well, I'm going to echo some of the same thing. Part of the problem from a statewide perspective is the economic impact that we all see. And as healthcare providers, that's not really what we're here to talk about, but it does have an impact, because as the largest employer, how it impacts me is going to really how it impacts the rest of the region. But the other major factor is because of the concern factor, is there are a lot of patients out there that we see that are putting off necessary either procedures or not coming to their primary care or pursuing their health needs just simply because they're concerned. And we get that, we understand that, but I don't mean it the way that I say it, but I guess I do. I just had a press conference a little while ago and said the same thing. Because people are asymptomatic, and you look at who it's impacting, and those that we have to protect are in that 20% at-risk factor. The concern is we've got folks that are shopping every day at some of the larger retailers, and they don't think anything about it, but there's concern with them walking into a hospital to where we've got PPE and we're cleaning every single day. There's no guarantee anywhere you go. We understand that, but on the same sense, is because of that fear factor that I'm afraid that it's going to keep people away from the necessary care that they really need. And that's what we've come to grasp with, is not trying to change the message, but I think that's what you're hearing even today, is that as we open up, we are being asked, which we would do anyway, every one of us, to take necessary precautions to make sure that we're going above and beyond to protect the safety of not only the patient, but also the community and certainly our employees. And then the last thing I would end on is what we don't know is what we don't know yet. And that is, it's going to be interesting, as we move forward with hopefully antibodies to determine what the impact of this was really throughout the state. And then I think that's going to change a lot of the way that we all operate as we go forward.
Jared?
Yeah, I would agree with everything that you've already heard. I think we need to really focus on those people, those patients, potential patients that have a coexisting condition, a comorbidity, if you will. I think that's something that we hear about in the news a lot, but I don't think we really think about all those folks that have those respiratory diseases that are out there, and the elderly. And we don't think about how, when you go to one place as Donovan talked about it, you go to a grocery store, you go to the Home Depot, and you're interacting with people, and then you don't think anything of it, and then you go and you see an elderly relative, or you're playing with your children, then your children go to your elderly relative's home, and that's community spread, as Garren talked about it, and that's how this disease is, and it's a dangerous actor in our community. We have to be so mindful of that, and I think it's hard to really put your head around it, but I think we really need to as part of the community. And I think Donovan brought up a great point, and it's that I referred to it already as, people that put off necessary medical care so that we could create the capacity for COVID patients in the hospitals. And I think there's a lot of fear out there that people don't want to really be back in the healthcare setting. They're afraid to use PPE supplies that other patients they perceive might need that PPE, or that they'll be clogging up the healthcare system. But I would tell you that if you don't come for care and you do have a chronic condition, a chronic cardiac condition, a diabetic, what have you, if by putting off care, you're actually causing a severe danger to yourself. And we want to make sure that that's mitigated. Those people that need care should come to the hospital, should seek care, and receive the care that is required to keep them healthy, so that they don't become, that condition doesn't get worse, and then they do become a victim of COVID. So it's all interrelated, and I think we have to be mindful of that as a community, and make sure that those folks get back into the healthcare system where they can be treated for those conditions.
Thank you. All right, let's start the next question with Donovan. How do you think Kentucky's done handling flattening the curve? And are there any additional steps you think we should take to do better?
For myself personally, I think the state's done a great job. I think the governor did what he needed to do with the information that he had on the front end of this. And as we have just said, when you look at the rates, for example, the death rates in Kentucky, almost half the death rate is coming out of nursing homes. And more than likely, it's because of people that are asymptomatic that are walking into nursing homes that don't realize that they have it. It's 80% that are putting the 20% more at risk. So from the governor's perspective and all the guidelines that came down through the CDC, I think it was the right message. I think everything was point on. I think now we need to do what's actually being done, is to really look at this thing regionally and maybe even geographically on where there is wider spread, and still having across the board policies that everybody need to adhere to, because when you start making exceptions for one or two, then all of a sudden people start falling through all the exceptions, and it's not really worth all the work that we've done. But I think, again, from the state's perspective, I think it's been handled appropriately. I think the timing is right now for us to be able to move forward in the manner that we're doing with this phase one, and then which started today. And then moving into the phase two, I looked at the guidelines that when we looked at elective procedures, and again, the necessity to open ourselves up to bring the people that need access to care, especially those that are putting off these decisions because of, for whatever reason, partly because for the last month or so, we've told them to stay away if at all possible. Now's the time. I think we've got enough data. We know where we're at. We're on the downside, hopefully, of the curve. That with the necessary precautions we've put into place, that we're able now to be able to take care of those people.
Thank you. Gerard?
Yeah, I think the state's done a phenomenal job. I think, calling it early and making sure that we put those, close those places where it could be spread, communicably through the installing the social distancing and shutting down certain businesses very early on has really helped us control the curve, if you will. What you've seen as a result of that is excellent. So it's a long curve, as opposed to the spike that we've seen in New York and other places that they call hotspots, where they really ramped up quickly and then now are coming down. Ours ramped up more gradually and continues along that plateau, if you will. Now we're seeing a decrease now, but it was a longer plateau period, but it was a much lower spike period. And I think the model shows that we were at our peak supposedly yesterday, I believe was the day that Kentucky went over. And because of that, it allowed us to have the capacity that we needed in the healthcare system. I don't think you saw any of the challenges that you saw in New York, where patients were lined up outside emergency rooms and there was not enough respirators and not enough ICU beds. I think clinically, Kentucky was able to do really, really well. I think the hospitals came together really well, all the health systems, all the hospitals, and what was our combined, we all had surge plans, but then what was our combined emergency response? It's not lost on me that those conversations happened between all of us on this call internally, and also there was a lot of facilitation by the governor's office, Governor Bercier, Dr. Steve Stack. You know, they've all were a significant part of that play, if you will, and have really helped us have an elongated curve and has helped us really respond to the crisis. It's through those acts that'll help us continue to manage through the COVID crisis as we go through the summer. We come out in the fall. We'll all expect they'll see a slight resurgence, as you'd expect. But I think we're all very well situated and positioned to handle that and be in a normal capacity type situation in the future.
Garren.
I agree. I think the steps Governor Beshear took should be applauded. I think we prepared for the worst and hoped for the best. And I think because we prepared for the worst, we did achieve the best. And so excited. I think, you know, what can we do better going forward? Obviously, as Jared said, you know, this is a community spread disease and we haven't been a community. So once we start opening back to a community, then we're going to see a little bit of that community spread, and how we deal with that's going to be important. I think progressing to get a vaccination will be a tremendous effort. But until we get that vaccination, you're going to see these spikes and reoccurrences until we get to that point.
Thank you. The next question was around capacity, but all of you all have touched on that already. So let me jump to the next one and start with Jer. And the question is, as you all know, is around elective procedures. I'm going to reframe it just a little bit because the governor's put out information today. You can find it on the various websites. Dr. Stack created a 5-page PowerPoint that is out there that's very comprehensive and spells everything out. But what are your comments relative to the phasing in of the healthcare system when elective procedures are going to come back on? What's your perspective on that, Jer?
I think it's an excellent plan. I think there's a lot of thought and design went into that by a lot of people, and I think it really allows for us to kind of test and go. So you open up phase one. It's really diagnostic imaging procedures, office visits for physicians, some pre-anesthesia testing for procedures that we hope will come next week or possibly the week after. So it allows us to test the system for a period of time before we move into phase two and then phase three, and ultimately, I believe, phase four. And by doing that test allows us to keep the amount of PPE on hand that we've all agreed we need to have this many days of PPE on hand, this much capacity available in our hospitals. So if there is a resurgence or a spike, that we can handle that quite readily and available. Because that's what nobody wants to happen, is to see us have this huge spike of the disease and then have to shut back down everything again. So a phased approach absolutely makes a lot of sense in the healthcare setting. And my anticipation is that the non-healthcare community business opening would kind of align with that as well, sort of a phased in approach. I would expect certain businesses will be able to come back in phase one, followed by other phases as we see how we as a community react to the disease and how good we are at social distancing and continuing to really be mindful about all those things that help us combat the disease.
Thank you. Garren.
I think what the phased in approach will allow us to do is put the safety of our providers, the safety of our associates, and the safety of our patient at the forefront, which is what you would want in any plan. So we're excited about that. I think a little later we'll talk a little bit about the financial impact that this has caused on hospitals and health systems across the country. But this will allow us to stop the bleeding, so to speak. And so we're excited about this approach. We didn't turn the economy off overnight, and we're not going to be able to turn it back on overnight. So this will be a well laid out plan.
Donovan.
I don't really have much more to add to that. I think they've said it all. Been very impressed with the plan. I think it's the right path. As I said, it's an introduction, allow us to take all the necessary steps to not only prepare, but again, to get our patients prepared also, and to protect both the patient and our staff. You know, the necessity to test prior to any type of procedure, and then again, this little ramp up. And then I failed to say this, but think it was said a moment ago also, not only thanking the governor, but part of this plan, my CMO was part of the task force as well as several others. But KHA and Dr. Stack did an absolutely wonderful job kind of coordinating this. And Dr. Stack's been very open and very accessible to any of the concerns that we've had. So the plan was, though this group put it together, a lot of CMOs making certain and CEOs, but making certain that the plan makes a sense, but also doesn't allow us to go backwards. So it does give us the opportunity of taking the necessary steps to be prepared as we roll it out, to make sure that we've got adequate resources on hand, PPE people, but it also does it in a way that's safe and make sure that we don't have a resurgence of some sort. So I commend the plan and certainly all the efforts.
Thank you. So let's move to testing. We'll start with you, Garren. My son watches the press conferences with me, so even he knows by now there's not enough testing in this country. So we don't have to beat that to death. But what's testing been like for you at your systems at this point, and what's that look like for the future?
Well, I will tell you, St. Elizabeth is blessed because Gravity Diagnostics are our next door neighbors, and we've partnered with them a long time ago. So we've actually had a pretty good supply of testing available in Northern Kentucky. And so we've utilized that testing. So 100% of the people in Northern Kentucky that has required testing was able to get testing. The thing that you have to keep in mind, what is the number one reason why you would test? Because if someone is symptomatic, you're going to quarantine for 14 days, whether they tested positive or whether they tested negative. And the test itself is only good the day of the test. So if we wanted to test everybody in Northern Kentucky, that test is only valid for that day. So then the next day they're going to go into work. That test really doesn't do anything good for that employer. And in fact, maybe some harm, because you may have people walking into work thinking they tested negative. And in addition, 30% of the tests are false negatives. So 30% of the people who test negative are actually positive and walking around spreading the disease. So what we tried to do is test our associates who needed testing, test all first responders, and test everybody based on the criterion that the CDC and the State Commissioner of Public Health identified early on. And then as that testing criterion has spread a little bit, we've opened up. So now we're testing asymptomatic people, even though originally we probably wouldn't have tested those individuals. And then open it up just for anybody to test. I think, that's probably wasting PPE, and you're not really seeing the true value of testing, which the true value of testing is so the health department can contact trace everybody who tests positive. And that's the real value of testing. So if you tested positive, and then let's go back 14 days to figure out who you've come in contact with to help stop the spread. But once it gets so community spread, it's really hard to trace all those contacts. So Northern Kentucky's been pretty good on the testing front. We are going to work with all the employers in Northern Kentucky, because what we think is most important is to do the temperature checks and to mask. And if you're handling food or anything of that nature, then glove. And so that might put a little more pressure on PPE in the community, because not everybody can get access to that many gloves and masks. But we're going to have to do what we can in order to get that PPE so that we can protect all employers in the community. Sorry, a little long-winded response there.
No, thank you. Donovan.
Well, testing's been probably one of our biggest hurdles. Being in Eastern Kentucky, there really isn't a local testing site, so we've had to rely upon initially LabCorp, and as testing started to become more and more throughout the state, then obviously the lag time started slowing down. So in the beginning, we started out getting results back in around 72 hours, and then within a short time, it was 12 to 14 days. The concern that we had, of course, I reached out to the governor and Dr. Stack, who called me back. We had a very long conversation on this issue. And a lot of the testing obviously is being controlled by the federal government. The reagent, just the supplies wasn't available. And as a Region 4, because of our, again, very few cases, we just were not a priority. So what we were having to do early on is actually do a test we had. We were using LabCorp and then Solaris out of Louisville, and then UK Health reached out and was able to take on some of our testing also. But we were physically having to put an employee in a vehicle and drive 2.5 hours every day that we were testing. We're still having to do that, but it's gotten much better. And we had Kroger. The governor, through the partnership that he was able to create, brought the Kroger testing into the market last week. They opened it up towards the end, allowing people that wanted to be tested to test us. So on the last day, we had over 500 people, or a significant amount of people. It wasn't 500, a significant amount of people show up. And as a result of that, we had 3 positive tests. But right now, we are actually in UK had reached back out, and we're actually able to start falling outside the guidelines and testing folks out of the clinic. We're getting about a 24 to 48 hour turnaround now on the test. We do have been working through the governor's office, was designated one of the hospitals that as reagent becomes available, we have we have 24 of the Abbott machines that just needs the update to the software. And then we were given one of the machines that came into the state as well. So as soon as the reagent's available, then we'll certainly be able to be a testing site for the eastern part of the state. And that's not all bad. We understand the circumstances, but right now, again, we're able to get anybody tested that we need. We're going to probably have an announcement later in this week about the opportunity of even testing more people that need testing with a relationship with our local health department. So right now, we're in actually pretty good shape, other than having to make the drive.
That's awesome. That's a great story. Gerard.
Well, we have the same hurdles that Donovan had. I think that's one of our biggest challenges is testing. It's still a challenge for us, of course. We're a little bit lucky in the fact that we're so spread out throughout the state, the different Baptist Health hospitals. So in UK, we're able to take advantage at Baptist Health Lexington of the UK lab. Here in Louisville, we have Baptist Health Louisville. We're able to take advantage of the Louisville lab. And of course, we are LabCorp throughout the Commonwealth. So we use LabCorp for testing as well. So we have lots of tests and lots of laboratories. As you understand from the news media, it varies in how quickly the tests come back. Some of it's 48 hours, some of it's 12 hours, and some of it could be a week. So we still have some challenges with testing throughout the Commonwealth. I think we all have experience with that. We do have we have many of the Abbott machines that people talk about throughout the Baptist Health system. So we're quite lucky to have those. But as Donovan brought up, test kits are a problem. So you can have this machine, but if you don't have the kits, then that is a significant issue. But we have plenty of capacity for Abbott testing throughout the entire Baptist Health system, which is good, and access to other laboratories that we use, including Gravity Diagnostics, which thanks to a mutual friend of Garren's, we got in contact with relatively early in the process, and we were excited about that. But as you know, going forward, that's going to continue to be as we go through the summer and the fall. We've got to get better testing throughout the United States. It can't just be in hotspot areas. It has to be facilitated much more quickly. Garren said it well. Your test is as good as it was 20 minutes ago. And then clearly there's false negatives. So, we have to make sure that the tests they work, they are accurate, they're appropriate, and they're widespread, so that we could actually track down the disease early, do the tracers that are required, so we can reduce the community spread. So this is going to be with us through the fall. We have to be mindful of that, and we have to keep the pressure on to make sure that Abbott provides those test kits that we need, that other labs are available and ready to do the testing, and that overall, I think is really important, they become more accurate. Because if someone has, if they're false, and you have this, oh, I'm fine, I'm clear, and then you can inadvertently spread that to many, many people unknowingly. So I think the pressure's on for testing for sure.
Thank you. Next question, we'll start with Donovan, and it's around the biggest challenges to this point, your biggest concerns moving forward. I think you've touched on that quite a bit. If there's anything you want to add.
I think we're going to hit the same thing. It's PPE testing, perception, and then our financial position.
Gerard.
Yeah, testing, PPE, and the financial position as well. I think we've all experienced significant downturns, and the economy is struggling, of course, and the healthcare economy is no different. And it's struggling along with the economy. The little bit of a difference is that we need to, for patient safety and for, the good of the population of the Commonwealth and Southern Indiana, we have to operate well and provide outstanding care to our patients. And there's a cost to that business. And unfortunately, with the downturn in the economy and the downturn in patient volume and all the additional capacity that's available, which is wonderful, it's also created significant challenges for us moving forward.
Garren.
The only thing that I would add, and I know we've talked a lot about it here today, but I think it's important. We really have to communicate to the citizens of the Commonwealth that hospitals are probably the safest public space you can be in. So please don't be afraid to come back to our institutions. We're going to need the community support. We're going to need it more than ever. Not a one of us is willing to share what our true financial loss is because the number is so big, it would be alarming. And so please give back. These heroes are in here every day working to save lives and to better this community. And the quicker we can get the community coming back, the better off we're all going to be.
Great, thank you. We recently discovered that additional deaths had been traced to the coronavirus in California weeks before the first actual case was reported in the country, showing that it had been here longer than we thought. Does that mean anything to you in your business? And I'll sorry, go to Garren.
All right, super. So we have what I'm going to say is a infectious disease physician who is just incredible, Dr. Savani. She's unbelievable. She let everybody in our institution know that the disease was in the United States for months before we even came close to getting our first patient. So we were planning far ahead for that very day. So I don't know if it means anything going forward because I think we're all aware of where we are today, but it helped us prepare so that we were ready. And I think that's probably true for everybody.
Donovan?
The only thing it means to me is it confirms what probably most of us already thought and knew, is that it's been around for a while. We saw unique cases before that we put a label on it, and that we started treating way back and started somewhat preparing, not to the degree that we are. And then the only other thing that it kind of means to me is, again, this necessity for a good antibody test, so that we can find out who's had this over the long haul, and I think not putting people at unnecessary ease, but at least allowing us to kind of get data that's needed so that we can kind of manage differently.
Right. Anything to add, Gerard?
Yeah, I think it does validate a lot. I mean, if you think about it, as Garren said earlier, 80% of the patients that have this have no symptoms whatsoever or minimal symptoms. So I think it was here for quite a long time before we're aware of it. And I think antibody testing is going to be key so we can rule out a whole bunch of folks who have already had this disease and have immunity of it for at least this year and or this season, if you will. I think this is going to be with us for quite some time, another strain of the flu, if you will, year over year. I don't think it's going to be eradicated. I think it's just going to be another strain that we're going to have to deal with, and we're going to have to develop vaccines for it like we develop the flu vaccine every year. So I think hearing that it's been in the country a lot longer than we initially thought is just validating a lot of things, a lot of assumptions we already had.
Thank you. All right, let's move to some questions that were submitted during the registration process. Start with you first, Donovan. What are the most pressing needs you currently have for PPE, and when do you think you'll have enough to be at full capacity?
We're in pretty decent shape now. We've seen the supply chain has opened up a little bit. Though the things that everybody still asks for, N95s, certainly the ability, supplies, it's not really PPE, but supplies for testing. Face shields, we started our own 3D printing process here, so we were able to actually manufacture quite a few of our own face shields. So it certainly has gotten better over the last couple of weeks. The concern is as we turn up this phasing process with these elective procedures, the burn rate that we're going to be looking at as a state is concerning. but I think it'll hopefully continue to get better as we go forward.
All right, Gerard.
Yeah, I agree. I think, PPE is always going to be a concern for a period of time, but our supply chains have opened up quite recently, and we feel we have enough PPE, adequate supply of PPE for our current volume plus COVID plus surge. That could change dramatically depending on what happens, as Donovan said, in the community and if there is a resurgence. So we have to watch the burn rate closely. And if you look at that plan that Steve Stack has developed with the help of the CMOs, when you get to phase 2, there's actually requirements of PPE, and it's on hand, days on hand. Not it's in my supply chain, it's coming. It actually has to be there. So I think, and that was it sounded like wordsmithing at the time, but if you actually think about it, it makes a lot of sense that needs to be there, especially when we see the struggles. You heard about it in the news where FEMA was coming in and commandeering supplies as they were making their way to the United States from vendors, and that put a lot of strain on the supply chain for the hard hit areas, if you will, outside of New York. So I think that that's now straightened itself out, thankfully, but we have to watch that closely in the future.
Garren.
I don't really think I have much to add, to be honest with you. The only thing I would say is, Donovan spoke earlier that our post-acute care, nursing homes, senior living, so getting them adequate PPE is probably the highest priority because we just don't want an outbreak in that setting.
Sure. Start the next one with Gerard. If you know, what disposable products and sanitary items continue to be in short supply?
The PPE in general, I'd say, has been a recent issue. And then actually hand sanitizer, gels, sanitizing soaps, if you will, solutions. That's been a bit of a challenge. But now, thank goodness, we're in bourbon country, and a lot of those folks have switched manufacturing over and are making that stuff for us. And it's very high grade, outstanding. I'm never going to look at that industry the same again. I want to look at them with compassion. Not only do I like the product, but now I want to think about what they did for the healthcare system to help all of us. So that's just top of my head. What I would say is PPE and those sanitizing solutions.
That's good. Garren.
For me, it's I don't know if you can see this. We call it the purple top. So I think when this outbreak hit, we're getting our supply every 7 days, which is keeping us in good standing. But the problem, as Gerard says, what happens if that 7-day shipment doesn't come? Then what happens? So we'll just deal with it.
Donovan.
Nothing to add. The two items that I would mention on top of PPE, and we actually here in Pikeville, my previous job, I was able to recruit a distillery downtown with Alltech, and to see the type of product that they're producing, and for all of our distillers to step out and do as they did has been phenomenal. And then the other side is that we're able to actually buy the hand sanitizer in a 55-gallon drum. So trying to be innovative to fill up the bags that you would normally hang up at the hospital has been unique. But outside of that, the same concerns we all have is just making sure that those supply chains stay open so that we can meet these standards that's been set forth as we continue to reopen. That's going to be key, absolutely key.
Sure. Start here with Garren. Are there any specific needs or considerations for behavioral health or intellectual disabilities?
I would think that my short answer is absolutely. I think that issue is underserved in normal situations. And I think something like this is only going to enhance that need across the board. And I think we all see that, what is taking place with students not being in school and people being at home at greater lengths of time. So yeah, it's only broadened the need for those services across the state.
Donovan.
I won't add anything more to it other than to say that I 100% agree. Obviously, this is put some additional focus and brought some things to attention I think we're all going to learn from, and there's absolutely an opportunity.
Jer.
Nothing more to add. I think I agree with everything that's already been said, and said well. Thank you.
Yeah, sure. This has been a crisis unlike any other, as you all know. What lessons have you learned to apply in the future, maybe this fall, as you were mentioning earlier, Jer, and I'll start with you.
I think we all probably have playbooks of what went well, and we should be proud of those things. But I think we really need to focus on what could have been done differently or better. And I think we're learning as we go, because we're still in the heart of the crisis, if you will. We're still on that plateau. We're waiting for it to come down the other side. So I think as we've, if you think about how in healthcare we scale down operations dramatically and quickly. You went from full operating capacity and all of a sudden you had to discharge massive numbers of patients, cancel schedules for procedures because you need to make capacity for patients that would have COVID that would come in. Then we ran the facilities the way they were, which was decanted. And then we had the flare-ups in the nursing homes, as Garren's already talked about, and some challenges there that we all uniformly gathered around and really executed strategies to help mitigate the crisis in the nursing homes, which is still an ongoing challenge. I'm not going to dispute that, but there's still work to be done. And then the next phase is, how do we come out of this? How do we ramp up? Which the phase plan you see. So that's the next part of this. So as we've come into it, we have to come out of it. And that's going to be the telltale, how well we recover from this and all the lessons learned from that to be, and what can we do better next time? So I think we're all watching. We're still in the middle of it. We're still in the middle of the crisis. Because if you think about it, once that ramp up happens, that's going to be the judgment. How did you come out of it? How did you scale up? And what went well? And what can you have done differently in order to really help the patients, the safety of your caregivers? I think Garren's already talked about that. That's of paramount importance to us, and the patients as they come in, and their patient safety is really important to all of us. So we're writing the book, and we're going to be doing a lot of analyzing as we go.
Thanks, Jer. Garren?
I think what you had to do very quickly is try to forecast what's next. So we were able to understand that the hydroxychloroquine was working, so we acquired as much as we could. We knew that it was going to Singapore next, and 80% of generic drugs come from Singapore. So we were trying to get as many as the generic drugs that we could. Because you had so many people on ventilators, you're running out of paralytics. So, we tried to secure as much of that moving forward. So trying to stay ahead of it. And then on the other side of this, is going to sound simple, but my infection rate, because we're washing our hands and because we're masking, is almost non-existent. And so what you're going to see probably in healthcare for some time to come is the masking of our associates, especially in the clinical areas. And then you're going to see some testing until we can get a vaccination on anybody coming in for a procedure that would cause concern from an aerosol point of view, a surgery, or something along those lines. So the normal is not possible going forward. There's going to be a new normal that we settle on, and that's I can't say what it's going to look like, but I can tell you it's going to include some of the things I just discussed.
Sure. With 6 minutes to go, let me move to the last two questions, and I'll start with you, Donovan. How can our community support our hospitals and lift up our Kentucky healthcare workers? And specifically, what can the rest of our business community do to help?
Well, the biggest thing to do is to continue to support us and keep talking about the things we're talking about now. As Kentucky goes back to work and employees go back and however they're phased as well, is understanding what we're talking about is that hospitals are safe and that we are relying upon them. Look, we are huge economic drivers for all of our communities, and for those businesses to continue to thrive and to grow, they need help. Not only some of the key essential businesses out there, such as education and healthcare, but we need their support. We need them to recognize all that they've done. And I don't mean it this way, but I guess I do, all the things and changes that we've gone through. As we just listening to the last question, the tremendous amount of pressure that was put on all of our healthcare workers on changing direction, literally on how we do business overnight, was amazing. And to see our everybody come together in the way that everybody did to really change was phenomenal also. Nobody griped, everybody stepped up, and we did it. We did it as a community, we did it as a state. And as a result of that, our people were protected. We were able to keep the curve down, and we're able to take care of business if we have a resurgence of this. So all that's great, but what we really need is to now come together as a second part of the community and to continue to support one another. I mean, my healthcare workers, I've got almost 3,000 employees. You know, they've been eating out. They, you know, they're doing it the way they're supposed to be doing it, but they're supporting businesses that are open. And, you know, we need to support one another if we're going to get through the other side of this from an economic standpoint as well, not just from a healthcare perspective.
Thank you. So let's close with an upbeat discussion. We'll start with you, Jer. What's been the most uplifting thing or story you've witnessed or heard during this public health crisis?
Well, there's many. You know, there's just two things. When you see a COVID patient being discharged from a facility, and you know, the caregivers clapping and applauding, and the family in tears and of joy that their loved one has come out of the other side of this, I think that's inspirational. And you know, the fire department in the parking lots, the hospital cheering on the caregivers, the heroes, the way those first responders are reacting to them. And then I'll close with, you know, it's really it also is emotional how grateful the frontline heroes, the caregivers are of all the folks in this hospital that people don't necessarily notice all the time. It's the food service workers, it's the engineers, it's the custodial staff, and they're there risking their lives every day, along with the doctors and the nurses' aides and the med techs, and then the respiratory therapists, and they're all there together, you know, treating these patients or being in that environment, risking that every day. And to see the respect of the nurse and the doctors and the medical folks towards those non-traditional folks, medical providers in the hospital, like I mentioned, is just, it really is emotional. It's wonderful.
That's great. Garren.
So last week I had the opportunity, and by pure circumstance, I visited our COVID hospital in Fort Thomas, and it was the same day that they just received 35 patients from the community, basically almost over about a 6-hour period. But to walk around and see the smile on their faces and the joy they had knowing that they were really making a difference, it was just phenomenal. I never dreamt that the morale would be as high as the morale is in those areas. And in fact, it was close to shift change, and they had to pull 2 or 3 people out of a room because it was the end of their 12-hour shift and they didn't want to leave their patients. It's just amazing. You know, you know, I never wanted to take the time to write a book, but if I could write a book, it would be just on that one day, that one site visit.
That's great. Donovan.
Well, you know, the same type of answer is just to see the community's outpouring and compassion upon what these folks do every single day. And, you know, they've been labeled by our heroes. And I talk about our first responders in the same way. We had a couple of parades to where the state police, the local city police, and the sheriff's department came out and in full fashion with all bells and sirens and everything going. But allowing our healthcare workers realizing what they're facing to be shown as heroes. And then the other side of that is that you know, there was a lot of publicity this past year with our teachers, and you know, our teachers in the community all got together and came back and put banners out front again, labeling our healthcare workers as heroes. But probably the bigger thing that I would say is, you know, I get the advantage of every day of coming to work and standing behind true heroes, not in front. I don't lead. They're the ones that are in the trenches every single day, but being behind and supporting them, and knowing there was a time of need that in this crisis, because people were coming out, we had a major blood shortage. And so our blood bank called out and said, we've got a shortage. And guess who stepped up? It was our staff. So not only were they given on the front line, they were given on the back line too, because this is what they do. And it just gets, you know, it's a blessing.
Thank you, Donovan. Thank all 3 of y'all, Jer, Garren, Donovan. Very well done. We appreciate you. On behalf of the Kentucky Chamber of Commerce, I want to thank everyone for watching. Watch the governor's press conference today at 5. Tim and Dr. Stack going over new healthcare information. And watch our CEO, Ashley Watts, tonight on 8 o'clock Eastern on KET. Everyone have a great week. Thank you.
Thank you.
Appreciate
Thank you, Jonathan.
Thank you. Bye.
it.